Here we are for round 2, COVID-19 and ibuprofen. What are we to do? In the first video, we looked at the renin-angiotensin-aldosterone system and talked about how ibuprofen comes into play here. Now we're going to go into the cell and see what effects ibuprofen has. We know that these membrane phospholipids are converted to arachidonic acid. And we know that cyclooxygenase acts on this acid and produces a lot of inflammatory substances. When we have a fever, when we have aches and pains, when we're not feeling good, we frequently think of these guys as the bad guys. And so we take our ibuprofen, which blocks these cyclooxygenase enzymes and does away with these inflammatory substances. However, these guys serve some important purposes, namely in the kidneys. When a pathologic condition is present in the kidneys, this guy, prostaglandin E2, will open up the afferent arteriole into the glomerulus. This will preserve renal function in a pathologic kidney condition. However, if I've taken ibuprofen, that does away with this compensatory mechanism and my kidney function can worsen in a pathologic condition. We know that COVID-19 can affect kidney function. And if it's affecting kidney function and I'm loaded up with ibuprofen, I may lose this compensatory mechanism and my kidney function may worsen. So what are we to do? Well, the World Health Organization has come out with the following statement saying they do not recommend against the use of NSAIDs in COVID-19 infection. So this is a non-recommendation. They're not recommending for it and they're clearly not recommending against it. It's a very soft position that doesn't really help us. So what are we to do? Well, on one hand, we have this theoretic risk of increasing levels of ACE2, increasing the amount of COVID-19 in the cells. We also have, in a setting of potential kidney injury, losing our prostaglandin E2. On the other hand, we have this very weak statement from the World Health Organization, which is not really helpful in making us a decision. So again, what do? Here's what I do. When I can, I've still got good old acetaminophen. It's a fantastic antipyretic. It will bring down temperature in these patients, and it doesn't carry these theoretic risks. I cannot prove a risk in COVID-19 infection with ibuprofen, but I'm switching to acetaminophen and trying to use that mainly. If you want to read more about this topic, you can check out my blog at haywoodmd.com/blog.